Thank you for everybody being here. It's a real honor to be here to present our case study to improve an integrated campaign against measles, meningitis. This is a collaborative um, case study. So to demonstrate the need for this project, Guinea has more and more epidemiological problems. So with financial resources, we're able to resolve some of the issues that we're facing. So um, unfortunately, most programs are vertical, not allowing us to truly understand how to improve vaccination. But this program allows us to work more closely with communities. So these these mass vaccination campaigns are often vertical, and often the same populations are left out. So poor campaign coordination also has rippling effects through the system, and it has an impact on how local populations are served. So this collaborative plan allowed us to optimize health programs. So the objective of this case study is to show how effectiveness of this collaborative approach would allow better distribution against meningitis. And the second measles dose is also something that's improved by collaborative work. So it's important to remind everybody that in Guinea we have COVID-19 epidemic, we've had Ebola epidemics, we've had measles outbreaks, and in December we also had a yellow fever outbreak. So the research question that we want to address is to find out what are the favorable factors and what are the obstacles throughout the health system, including impact on the community in terms of services that might have an impact on the MEN-AFRIVAC integrated campaign. So we have identified some questions, and we've identified some approaches to address these questions. So the first, what are the most important stakeholders in the decision-making process for the collaborative campaign? So to answer this question, we went on to mapping and characterization of key stakeholders in order to develop relevant strategies for better decision-making. Second, what are the challenges and opportunities related to collaborative micro-planning of the meningitis integrated campaign in Guinea? So there too, we wanted to have a situational approach in order to engage in joint planning. We also wanted to find out what are the advantages and the disadvantages perceived by health workers and community related to the integration of the meningitis campaign in Guinea. So we interviewed health staff to understand their perceptions. And so we had focus groups and interviews, and we really wanted to evaluate community engagement and their perceptions with respect to health campaigns. So the program will be put in place in the Kankan region of Guinea, in the east of Guinea, northeast, and we have 2.157 million inhabitants. And the geography really motivated the choice of region. It's a region that is in the meningitis belt with meningitis outbreaks. It's a region where an enlarged vaccination program is important to really in order to really strengthen activities. So this region experienced in 2015 mass vaccination campaigns, the MEN-A, and then we're also mass vaccination campaigns for measles. So that's what motivated the choice of this region. And the goal of this program really is to help decision makers in Guinea and various technical and financial partners to identify means of improving effectiveness of campaigns and how to strengthen the health system, particularly vaccination campaigns and the enlarged vaccination campaigns. So the result sought is improvement through collaborative planning and good practices, opportunities and challenges with respect to vaccination campaigns. So we used a mixed methodology with quantitative and qualitative dimensions. So the qualitative dimension involved interviews, focus groups, and surveys, and among those that were supervising campaigns. We had interviews of population, uh, health authorities, program officers, partners, health actors at the decentralized levels and communities. So we engaged in collaborative planning and implementing and how to supervise campaigns as well. So the main stakeholders for this project are the management coordination support of programs department, as well as the expanded immunization program. At the government level, we had disease control and epidemic department at the university hospital and the regional health management of Kankan and the sub-prefect of Kankan. So implementing partners, University of Conakry and University Kofi Annan in Guinea. So we just had an online meeting, and during that meeting, we discussed implementation and orientation in order for this project to really succeed. And then there are other partners, the Ghanaian Red Cross and the Health and Sustainability Development Fund. Um, in terms of stakeholders' needs, we have coordination. So we had meetings in order to study decision making by authorities and their participation in planning, participation in collaborative planning, in meetings, evaluating the integration plan, and participating in implementation through supportive supervision, independent monitoring, and community engagement. So we identified some advantages and some opportunities as well as limitations to this study. This list is really not exhaustive and it will change as the program goes on. As I was saying, first is campaign integration. It's a real opportunity because it turns out that it's really central. And we believe that this will facilitate the integration of vaccination campaigns and other health campaigns, whether we're talking about tropical diseases or malaria. We also believe that the advantage is that efforts will be concentrated in collaborative planning. So we're thinking about a reduction in logistics, operations, and costs. Another advantage is that the campaign will target the same population, children up to 23 months, 12 to 23 months, and that's that same platform. So it's also another advantage is the ability to use the same health personnel at all levels of the health pyramid. So limitations, time and resources are limited. We have a continuous delay of the campaign given the context of several epidemics. And we also have an issue that campaigns have to take place 3 months. So we've had some reductions. So the month of January, so we had planning problems. So we had some dates that were not necessarily effective. Lessons learned Uh, integrated campaign effectiveness is improved through collaborative planning and good practices, using opportunities and good practices. And these can be documented as far as challenges. Um, so challenges and opportunities are related to how information is documented and disseminated to all stakeholders. So the idea is how to identify the process or determine the process in collaboration with key actors and to seek out better opportunities for integrated planning. And another tip is to make sure that everybody is fully motivated so that we can really improve community engagement, targeting those populations. So I'll conclude with that particular image, and then just I'd like to say thank you for listening.